Last call, if you could come on over and join us in the chairs or continue your conversation out in the hall. So hopefully it won't take a lot of imagination for you to figure out why it was that we thought this would be an interesting and timely forum. Some of the news coverage has died down, actually, around this issue, but certainly the issue hasn't gone away. So you know that there was a big measles outbreak in California. Was it January? Mm-hmm. Back in January, and that started a public conversation, made public a conversation that had been going on in sort of more private ways for a long time, this question of vaccinations and who gets them and who is choosing to not get them and why. And, there are no lightly held opinions on either side of this. There's never a lightly held opinion on a parenting issue, right? Have you ever heard anyone say, oh, I would like to gently recommend that you do it the way... No, it's like your child will die if you don't do it the way I did it, right? So we'd like to not have that kind of conversation. Everybody gets to have the opinions that they have, and we'll honor and respect those and hold space for those. But we'll keep it gentle, in full of Christian love. So luckily, we don't have to have that conversation alone, uninformed, and based on just whatever we found on Facebook or on the internet. We have an expert in our midst. Thanks be to God for Tom Welch, who agreed to do this in the midst of a very busy schedule, as you can imagine. I'm grateful for this time, Tom. As I said in the words of welcome for the service, Tom is medical director at Golisano Children's Hospital and professor and chair of Department of Pediatrics at Upstate Medical University. So who better to speak to the science behind these questions than this man right here. So a warm welcome for Plymouth regular Tom Welch. Welcome.
Thanks. Quinn, thanks. This is actually sort of a first for me. I do a lot of speaking to medical groups, and actually I've done quite a bit of speaking to church groups, but when I'm speaking to church groups, it's usually fundraising for the Children's Hospital. So I will try to avoid that because there's some other fundraising priorities that we have here. When Quinn first talked to me about this, I really wondered about it, but then as I gave it some thought, there actually are several ways in which religion in general and Christianity specifically intersect with the issue of immunization. So I think it's really a very appropriate thing to be talking about today. First of all, as we heard in the sermon, and is absolutely correct, especially in the United States, in New England in the 17th century, actually 17th and 18th century, some of our great Christian leaders were really very, very important in promoting the idea of, we'll call it immunization, I'll use that term interchangeably. So religion historically has played a very great role in the issue of immunization, both positive and negative. We'll get into some of the negative ones in a minute. The second reason that I think it's very appropriate to talk about immunization in church is that it opens us up to what I think is one of the great beauties of creation. The physician-scientist looks upon the body's immune system just like you do a coral reef or a sunset. It's an absolutely remarkable bit of creation, and I'm going to try with a few minutes of what I say to just kind of introduce you into the beauty of how the body's immune system works. And the final reason that I think it's important to talk about this topic, it opens up some issues related to children and the way we care for children and the way we view children historically, both legally and religiously. So just in terms of religious history, just in terms of the beauty of the immune system, and in terms of the way we look at our children, I think this is a very, very good topic. So what I'm going to try to do today are three things. I want to introduce you a little bit to this immune system, which I think is so exciting. And I'm not going to, trust me, you're actually going to, I think, really appreciate this, and if nothing else, walk out and look at the beautiful sunshine and say, well, not only did the Lord create the sun, but created this wonderful immune system. I'm then going to tell you a little bit about just a few of the diseases that we immunize against, because Quinn made a very important point in the sermon that Boston in the 18th century had gone for quite a while without seeing smallpox, and there was no sort of municipal memory of what smallpox was like, so people got a little complacent. And unfortunately, the success of immunization in children has been so great that after a generation or so, we've sort of forgotten what tetanus and polio and some disorders like that were. So we're going to talk a little bit about those. We're going to say a few things about some of the objections that had been raised to immunization. I'm not going to spend an awful lot of time on that. And finally, I want to wrap up just by introducing the topic, and maybe this is something we can chat about afterward, of what immunization teaches us, how it sort of opens the window on the way we treat our children and the way we look at our children, because I think immunization is a beautiful window into that problem. So let's start with Immunology 101. This is only going to take 2 minutes, but I think it's really important to understand, both to know what we're talking about with immunization, but also to give you this window into what I really believe is a marvelous act of creation. Hippocrates, the Greek physician millennia ago, recognized that there were some diseases that if a person acquired the disease and survived, she would never have it again. So you'd get this disease. If you died, which you generally did in Hippocrates' time, it was too bad. But once you had the disease, you were immune to it. You were resistant to it. You would never have it again. So this observation that Hippocrates made went on for centuries. People recognized it. It was sort of common knowledge, but nobody really understood it. Why is it that some disorders may affect us pretty severely, but once we've had it, we never have it again? We've actually learned in the last century how this works, and it's absolutely remarkable. When a virus or a bacteria or some other organism that causes disease gets into the body, some organism that the body hasn't seen before, a lot of things happen very quickly. Some cells pick up a few of those individual organisms, they digest them, and then they literally measure them, look at their configuration, see what they're made of, and then the body creates an antibody, a protein that's specifically targeted for that fits into the nooks and crannies of that bacteria. Think about it. It's absolutely a remarkable process. It would be difficult to duplicate in the lab. A bacteria comes into our body, and over the course of a few days, we actually develop a protein that will stick to that bacteria, immobilize it, and allow it to be removed from the body. It's a fantastic, fantastic piece of body operation. There's only one problem with it. The first time you get exposed to that bacteria, it takes a while for everything I described to happen. So that the first time you're exposed to that bacteria or that virus, you may actually die before the body has a chance to make the antibody. But if you survive, then your body has this memory, so the next time that virus or bacteria gets in through your nose or through your mouth, then immediately the body turns up all these antibodies, attacks it, and prevents disease. So that, we know from the last 100 years, explains what Hippocrates recognized millennia ago. That's really how our immune system works. So really, all immunization is our way of tapping into this beautiful act of creation, using our minds to figure out a way to marshal the body's own way of protecting against disease, so that with an immunization, we can actually protect against the first time the bacteria gets in, rather than waiting until the second. So the idea behind immunization is very simple. We just take the little virus or the little bacteria or whatever it is that causes disease, and we treat it in such a way that it is no longer able to cause disease. It no longer is able to incite disease on its own. However, it looks like its parent. It looks like the regular, ordinary disease-causing virus. We put that material into a person, the immune system gets turned on, develops antibodies, stores the memory for those antibodies, and is already, the first time that wild-type bacteria that can cause disease hits the individual, bingo, the individual already has immune memory, turns on antibodies, attacks that virus or bacteria, clears it from the system, and prevents that first attack of whatever the disease was. That's really all there is to it. Immunization is simply tapping into the immune system that we already have. In a sense, it's really a very natural thing. Immunization is much more natural than using antibiotics or surgery or anything else because, again, immunization just taps into the property that the body has. Now, once you understand how this works, it makes a lot of things about immunization all of a sudden make sense. Booster shots. Well, the immunologic memory is just like our own memory. Sometimes it slips, and if you don't think about something for a while, you may sort of forget it. All a booster shot is the way of reminding the body, getting those cells that produce antibody turned on so that they'll be ready to go at the time they really get challenged. The other thing that understanding this immunology helps us to do is appreciate some things about how diseases work and why some immunizations actually have the potential for eliminating a disease completely, so we never have to worry about it. But other immunizations will never be able to do that. Let me give you a couple of very simple examples. Tetanus. Tetanus is a disease. I'll tell you a little bit about tetanus in a moment, but understand that the bacteria that causes tetanus is in the dirt. It's all around us. If you garden, if you farm, the spores of the bacteria that cause tetanus are there. They are all around us. So it's possible at any time to acquire tetanus. So even if there's nobody around you who has had tetanus, if you're not immune to tetanus, you can acquire it because that organism can live outside the human body. Smallpox is different. In September of 1977, there was a young man in Somalia by the name of Ali Malin. And Ali was presumably walking down the street of his village and sort of like what Quinn described in the sermon, started to feel a little bit uneasy, had a little bit of a sore throat, developed a fever, and all of a sudden had a rash and realized that he had smallpox. Well, people were watching for Ali, and his illness caused a huge number of epidemiologists, investigators, physicians for the World Health Organization to descend on his village. They isolated Ali. They made sure that all of his contacts were immunized against smallpox, and they waited. Okay? Ali got better, fortunately. Days went by, weeks went by, months went by. Nobody else in the village got smallpox. And so Ali Malin goes down in history as the last human being to have naturally acquired smallpox in 1977. So we no longer are immunizing or vaccinating for smallpox because we have eliminated that disease. And the reason we were able to eliminate it is, unlike tetanus, smallpox only spreads from person to person. So once you've isolated the last person who had smallpox, you can confidently say, nobody else is going to get smallpox. Amazing to actually have wiped out a disease, to eliminate a disease. We were close to doing that with polio. About 10 years ago, the World Health Organization said that we are within a few years of eliminating polio worldwide. And they sort of did the same thing that they did in eliminating smallpox. They watched all over the world. Whenever there was a little outbreak, they sent an army of people in to make sure everybody in that outbreak was appropriately immunized against polio. And that was actually working very well. And it was looking like polio would be completely eliminated because that's another disease that can only be spread from person to person. So once the last person in the world has recovered from polio, then nobody else is going to get it. Unfortunately, the places where polio was remaining, Nigeria, Afghanistan, Pakistan, Somalia, as you may have read, there are a few other things going on in those countries. And some of the workers for the World Health Organization that were trying to spread polio immunization actually were murdered, executed by religious folks who seemed to think that immunization against polio was a violation of some tenet of their religion. So some diseases, polio and smallpox, we can totally eliminate and ultimately might not even need to immunize for. Other diseases, tetanus, no matter what we do, they're always going to be with us. Okay? So I want to now just take a couple minutes to describe for you some of these diseases we immunize for. Because again, we have short memories. And many of these are conditions that we know the name, but we don't know anything about the disease. And as I talk to parents sometimes about immunizing their children, things like measles, polio are just remote names. They have no idea what these conditions are really like. So I'm only going to tell you about 3 conditions, and I chose these specifically. One of them is tetanus, a disease that by the time I got started in my own personal memory, I had never seen or heard about. Tetanus had been pretty well controlled. The second one is polio, which I and a few people here probably remember, not in my professional life, but actually from some of my friends. And thirdly, a condition called Hib, haemophilus influenza, which is something for which immunization became available during my professional lifetime. So I actually had the opportunity of caring for children with this disease and now having medical students with me that have never heard of it before. So those 3 things, tetanus. Tetanus goes by the name lockjaw, and I guess that's okay, but calling it lockjaw really trivializes what tetanus is. The spores of the bacteria that cause tetanus get into a wound, they start to grow there, and they produce a toxin. And it's actually that toxin, not the bacteria itself, that causes the problem of tetanus. That toxin attacks muscles and nerves and basically puts muscles into a continuous state of spasm. So the patient who has tetanus is just continuously contracting painfully and strongly every muscle in their body. The diaphragm with which we breathe is a muscle, so the diaphragm is in a continued state of contraction, so breathing becomes very difficult. The esophagus, the swallowing mechanism, and the throat, that's all muscularly controlled, so the patient who has tetanus no longer has that ability. So in the developing world, where tetanus is actually still quite common, the mode of death in tetanus is one of the most devastating, one of the most terrible to observe diseases one can imagine. The patient is just contracted up, unable to handle secretions, unable to eat, unable to drink, unable to breathe. So basically, tetanus is death by suffocation and starvation. Just a terrible, terrible thing. We still have tetanus. A year and a half ago, we had an Amish child, a 10-year-old, in the hospital for 8 weeks with tetanus. He had acquired it working in his farmyard. Interestingly, the Amish they don't actually object to immunization. They have some social reasons why they pick and choose what they do. They don't really have any religious objection. But the treatment of this child was successful, but what it involved, because his diaphragm didn't work, he had to be on a respirator. In order to deal with the muscle contractions, he had to have a continuous infusion of a drug that completely paralyzed him. It's actually one of the drugs that's used in lethal injection. He had to be given food intravenously, and because this was all so terrifying, he had to be continuously sedated so he wouldn't remember any of this. So this was a horrible, horrible situation that cost hundreds of thousands of dollars to treat this child. Could have been prevented by a simple childhood immunization. So that's tetanus, and it's still with us. Let's talk about polio. I can't describe polio any better than Sean Kurst did in the Post-Standard a couple weeks ago. And if any of you haven't read, Sean Kurst is this just beautiful columnist for the Post-Standard, wrote a beautiful column a couple weeks ago about a lady in DeWitt whose 6-year-old twin died in a polio epidemic that was sweeping through the Moses DeWitt Elementary School. Several children in that school became sick with polio. This child and one other child died. And this woman, who's now in her 60s, was recounting the experience of losing her 6-year-old brother and not being able to attend his funeral because she had developed polio herself. Fortunately, had a better outcome than her brother. There was a time in the 30s, 40s, and 50s when parents were afraid to send their children to swimming pools. There would be epidemics of polio, and putting your child into an environment with a lot of other children was considered just too risky. When a child came home with a runny nose or a little bit of fever, you didn't think, oh, this is a cold. You thought, oh my God, this is polio. When I was in first grade, One of my classmates, Mike Venera, developed polio, was paralyzed, had braces that he wore, and went around with crutches. I'm sure many of you that are my age or older have friends or knew of someone who had that. So when the polio vaccine became available, there was no argument among parents. There wasn't even argument among children. When the school nurse came into my first grade class to start giving polio shots, Sister Anna Joseph, in her wonderful way, said, "All right, you're going to have this shot so you won't become a cripple like Michael." So we had no problem rolling up our sleeves, and polio obviously has now been certainly eliminated in the United States, unfortunately not worldwide. So that's polio. The third condition I want to tell you about is one that you probably are not familiar with. It's a little bit more unusual, but I used to see an awful lot of it. It's a bacteria called HIV, H-I-B. And this bacteria actually can cause infection in many different places. It gets into the circulation and then it sets up housekeeping. Some people get a skin infection with it. Some people get pneumonia with it. But one of the worst things that can happen, it can infect the lining of the brain and cause meningitis. And this particular bacteria, when it causes meningitis, eats into the brain, causes abscesses in the brain. And although we don't see this condition anymore, fortunately because of immunization, I still have adolescent and young adult patients who were devastated by Hib infection, who are basically vegetative because of the effects of this. The Hib bacteria sometimes infects the throat. There's a little organ in the throat called the epiglottis, and it can swell up from a Hib infection and cause a sudden obstruction in breathing. One of the most terrifying things that a physician can see, a child who all of a sudden is completely unable to breathe. Little known historical fact, this is what killed George Washington, epiglottitis. These conditions, Hib meningitis, Hib epiglottitis, were common in pediatrics when I started practice. Anytime I saw a kid with a sore throat who was having a little trouble breathing, I was terrified that I might be facing a case of epiglottitis. As I said, though, during my professional lifetime, we've developed immunization for this, and the medical students and residents that I teach today have never seen it. They've heard about it, but they've never seen it. So tetanus, polio, Hib, horrible diseases. Unfortunately, many of us don't have the memory to think about what those diseases really were at a time when they used to happen. All right, well, that's the immune system. That's some of the disorders that can be prevented by immunization. So why, with these horrible diseases that can be prevented by something that is really just tapping into an active creation, why is there an objection to it? Well, I'm just going to hit upon, as Quinn said, I'm not going to get into a big debate about this because, frankly, I don't really think there is a debate. But I just want to let you know about some of the reasons that people have advanced to oppose one or more immunizations. And the interesting thing is, just philosophically, whenever you confront objection to something that occurs for several different reasons, you have to be a little bit suspicious. And the immunization area is one in which the objections that people raise are so diffuse, you have to really suspect that maybe there's a little something else underlying this than science. So I just want to hit you on a couple of the things that people have raised as concerns with immunization. The first is a chemical. It's a chemical by the name of thimerosal. It's a form of mercury, and it's been placed in immunizations as a preservative to protect the vaccine, to keep it from getting contaminated when it's being used. A different form of mercury in higher concentration is sometimes associated with some nerve damage. It's a different form of mercury, much different concentration, but there was a huge movement, not driven by scientists, but largely driven by celebrities, actually, that called for the removal of thimerosal from vaccines because that thimerosal was causing neurologic problems in children, such as autism. Even though it really didn't make any sense scientifically, several years ago, the American Academy of Pediatrics did something which I think they have forever resented. They said, we don't think there's any evidence that thimerosal causes problems, but just to be on the safe side, because people are worried about it, let's take it out of vaccines. So actually, thimerosal has been removed from vaccines in the United States for over 5 years. So we've actually done an experiment as to whether thimerosal caused autism. What's happened to the incidence of autism since we took thimerosal out of vaccines? It's gone up. So in a world where people were thinking logically, the appropriate response would be, well, we tried it. I guess we were wrong. But of course, that's not the case. If you Google vaccines and autism today, you'll still see people concerned about thimerosal and vaccines, even though it hasn't been there for 5 years. And you'll also see that now we've decided, well, maybe it's not the mercury, maybe it's the aluminum. So now you're going to read about everybody trying to take aluminum out of vaccines. So this thimerosal thing, frankly, has gone away. But it had an unintended consequence. Yeah? Good question. This particular celebrity that I'm thinking of was not a Scientologist. She was wasn't going to get into this. She was a Playgirl centerfold, actually. Not a Scientologist, but the unintended consequence of taking thimerosal out of vaccine has been substantial. It was in there as a preservative. So all of a sudden, we're making vaccines without preservatives. So what do you do to keep vaccines from spoiling? Well, you're going to have to put them in single-dose vials, and you're going to have to refrigerate them. That's no big deal in the United States. It increases the cost of vaccines a little bit, but they already cost a lot. What about in the developing world where temperatures are 100, 105, 110 degrees, there's no electricity? By taking thimerosal out of vaccines in response to a Playboy centerfold, we have basically set back the ability to provide immunizations in the developing world and have increased the cost of doing that enormously. Okay? Another objection beyond the thimerosal that sometimes comes up with vaccines is what I like to call the immune overload idea. Now, let's hear me out on this one. No question the incidence of autism has been increasing over the past couple decades. The number of diseases that we immunize for has also been increasing over the past few decades. Therefore, we immunize too much, that's what causes autism. Of course, there have been a few other things increasing over the past few decades. Global warming, Republicans in state houses, you could kind of plot almost anything. But people have focused on the idea that all these immunizations are just overloading our immune system. Well, I gave you Immunology 101. I'll give you Immunology 102. It is correct that we are now immunizing for many more diseases. But here's the thing. Immunization science has gotten much, much better from the days of smallpox vaccination. Okay? In the days of smallpox vaccination, what people were vaccinating with was basically a whole organism that had probably 300 or 400 different components. So when you immunized somebody with smallpox, their body was actually responding to 300 or 400 individual components. Modern vaccines are much, much more targeted. The Hib vaccine that I mentioned doesn't take the whole bacteria. What scientists did was just pull out the most important part of that bacteria, just a few little amino acids in length, and that's what we immunize with. So in fact, although the number of diseases we've been immunizing for has increased, the number of antigens that we've actually given to the immune system has decreased. And in fact, getting one smallpox vaccination gives you more antigenic stimulation than all the other immunizations that we give throughout a lifetime. Again, that's just the reality. And the idea that we're overloading our immune system with all of these antigens just doesn't really make any sense. One other little caveat, we actually know now that there's nothing wrong with overloading the immune system. The immune system is just like the musculoskeletal system, use it or lose it. And in fact, there's evidence that children that grow up in rural areas on farms, assuming that they're immunized, that are exposed to a lot of antigens, have less problems with allergies, have less problems with recurrent respiratory infections. So there's really nothing wrong with overloading the immune system. That's what it's designed for. Okay? So that's the immune overload. Let's say a couple things about religion, because religion has played a role recently in backing off on immunizations. And I'll give you one example of that I think is really a very, very unfortunate example. One of the newest immunizations that we have today is what's called HPV, human papillomavirus. Now, HPV is not a particularly bad disease. In fact, you probably never met anybody that said, oh, I had a bad case of HPV the other day. It's actually a wart. And individuals who get the HPV infection sometimes will develop little warts, and they're on the genitals, actually. But these are self-limited. Most of the people who get HPV actually don't get any symptoms from it at all. So you're probably thinking, why would we want to develop a vaccine against a condition as trivial as warts, which some people don't even have symptoms from? Well, once you have the HPV infection, it stays in the body, plays around with some of the cells in the body, and after a few decades can produce cervical cancer. So in fact, we know now that every single case of cervical cancer is caused by HPV infection. So in fact, if we can prevent HPV infection, we can eliminate cervical cancer. So it's amazing. And I'll tell you another thing. My wife would be happy about this. A little too late for it, though. If HPV immunization was universal and human papillomavirus was eliminated, you wouldn't even need an annual pap smear. I mean, that should be one of the best ways of pushing this immunization. So basically, the HPV vaccine is a vaccine against cancer. I mean, imagine if there was a vaccine against breast cancer or lung cancer, people would leap to it. But there's been objection to the HPV vaccine in children. And that objection is it will cause them to have sex early. Because if HPV is going to be effective, it has to be administered before, I love this term, it's a medical term, sexual debut. So it's generally accepted that if you want to get most children before sexual debut, you have to get it at about age 11. So there are people, often for religious reasons, that are vehemently opposed to HPV vaccine in 11-year-olds for the reason that they would then be more likely to have unprotected sex. Now, we've actually studied this. There have been very good studies. It's not the case. And actually, anybody who knows teenagers, how many teenagers, when they're trying to decide whether to have sex for the first time, will say, well, what would mom and dad think? What would happen? Could I get pregnant? Oh, wait, I've had HPV vaccine. I'm going to go for it. I mean, it doesn't make any sense in terms of how people think. And yet, that argument has been raised. And even though the argument has been kind of blown away, people are still opposed to it. Michelle Bachmann, I'm sure you remember Michelle Bachmann, was quoted as saying that she heard that there were children that were becoming mentally retarded after getting the HPV vaccine. Okay? So that's religion. Yeah? I'll let you ask Michelle Bachmann that question. Yeah, I was instructed to do this with love. So I've already crossed the boundary a couple times. Yeah.
Does it protect against any STD besides?
No, it's only HPV. Yeah, it's not a protection against any of the other sexually transmitted diseases. That's a very good point.
You wouldn't make them super people.
No, that's a very good point. No, it certainly wouldn't do that. Well, the last objection that I want to get into, and it's not really objection, but it transitions into the last thing that I wanted to talk about, is the issue of children and what immunization tells us about our children and the way we look at our children. One of the objections that ultimately comes up whenever you discuss this is, well, it's really the parents' choice. Parents are the owners of their children. They are the people who are ultimately responsible for everything related to their children. So regardless of what the science says, if parents don't want to immunize their children, they really should have that luxury. They should really be able, respecting their own beliefs, not to immunize their children. So it's a very interesting concept. And when you first hear it superficially, yeah, it makes sense. We don't want government telling us how to raise our kids. As Quinn said, that really doesn't make any sense. But let's think about it for a minute. The whole concept of children as the property of their parents was actually a very long-standing one, both legally and religiously. If you look at religious writings and legal writings from before the 19th century, there's actually very little consideration given to children, and children basically had the same status as farm animals, pets, and wives for that matter. They were the property. And with that idea, then the idea that parents could make life and death decisions for their children flowed directly from that. Well, of course, one of the first religious leaders to challenge that was Jesus in Matthew, who's really one of the great religious leaders that actually recognized children as senescent beings that were capable of understanding his teaching and actually should be emulated by adults. That was one of the many heretical things that Jesus said. So that concept religiously, I think, really changed with Christianity. Legally, the concept of children as property of their parents dramatically changed in 1875. In 1875, in the Hell's Kitchen area of New York City, there was a little 10-year-old girl named Eva Wilson. And Mary Ellen Wilson. And Mary Ellen was with a foster parent who beat her quite severely, starved her, put her in tattered clothes. The neighbors were very, very upset about this. They called the police. They called the equivalent of social workers at that point in the 19th century. Nobody seemed to be able to do anything about it. So many of you have probably heard this story. The way Mary Ellen was ultimately saved from all this, someone called the Society for the Prevention of Cruelty to Animals and decided that if it was illegal to treat your horse or your dog like this, it ought to be illegal to treat your child. So Mary Ellen Wilson was pulled out of that family. The American Society for the Prevention of Cruelty to Children was founded. And, of course, over time, we have begun to recognize that children have rights independent of their parents. And this exists in medicine. I have gone to court on a couple different occasions to get an order to force Jehovah's Witness parents to allow a blood transfusion to their 5 or 6-year-old child. If an adult Jehovah's Witness patient shows up with a bleeding disorder in the emergency department and says, I don't want any blood, then we respect that, would not do it. On the other hand, we don't believe that a 6-year-old has the right or does not have the right to make a decision that, I think I'd rather live to sexual debut by getting a blood transfusion now than just being allowed to bleed to death because of my parents' religious beliefs. Same thing you've probably read in many circumstances of cancer in children whose parents want to provide homeopathic, natural treatment. The courts have ordered them to receive therapy. So there certainly are examples of situations where we recognize, because of the independent rights of children, that sometimes those rights, including the right to health care, may actually trump the ownership rights that their parents have. And probably the best example of this, and something I want to close with, I didn't pass out the handout before I talked because you'd all be reading it instead of listening to me. This is an op-ed piece by Paul Offit in the New York Times a few weeks ago called "What Would Jesus Do About Measles?" And he describes a situation in the early 1990s. There was an epidemic of measles in Philadelphia that was centered on 2 fundamentalist Christian parishes that taught that immunization and healthcare in general was unnecessary and a-religious, that prayer was really all that was needed. Sort of a Christian Science type of perspective. Eventually, several hundred children developed measles, and actually 9 children in Philadelphia died of measles during this epidemic, several of them from that church. Despite those deaths, the church continued to insist to its parishioners that it was wrong to immunize their children. So finally, the City of Philadelphia Health Department used its police powers, which actually health departments do, to say basically, screw the parents, these kids need to be immunized. They took temporary custody of the children, immunized them against measles, returned them to their parents. That was the end of the epidemic. The thing I found best about this story was that, what do you think the reaction would be of the minister when he heard that the health department was doing this? Who would he call? Well, yeah, he had an unlisted number. He called the ACLU. Right? You call the ACLU. You know, they defend the Ku Klux Klan. They defend the Nazis. You know, I thought the ACLU took on any case. They called the ACLU and they said, no way. There's no constitutional right of parents to martyr their children for their own belief. That was a quote. So even the ACLU would not take on the concept that there are certain circumstances in which the rights of parents really have to be trumped by the rights of children. So we've got a few minutes for some questions. Again, what I tried to do was tell you a little bit about the science, tell you a little bit about the diseases involved, some of the objections, and then a little bit about what this whole thing tells us about our relationship with our children. Yeah?
Going back to your story about our immune system.
Yeah.
What diminishes who's at risk? How do we get there?
Sure. Yeah, that's a very good question. And the immune system, you know, the arm and the eyes, those are all organs you can see. The immune system is made up of cells, and they're largely blood cells. And anything that diminishes the numbers of our blood cells is going to diminish our immune system. So, for example, somebody who is being treated with chemotherapy for cancer, one of the side effects of cancer chemotherapy is to decrease the number of immune cells. And so patients that are receiving chemotherapy are at risk for a low immune system and developing significant infections. HIV infection, the target of HIV infection is actually a specific type of blood cell, the lymphocyte, that is involved in the immune system. So HIV infection and actually some other viral infections kill off lymphocytes. Those are one of the major drivers of the immune system. So those are two things. Sometimes a simple viral infection can kind of knock your immune system down, especially with older people. That's why somebody may get influenza, and just as they're starting to get over that, they'll get some horrible, overwhelming infection that may kill them. And that's because that initial influenza may have knocked down their immune system a little bit. Yes, ma'am?
Because this is mostly a lay audience, and you talked about a great job of describing immune and low immune, it might be interesting for people to hear about hyperimmune, what an allergy really is.
Sure.
Context.
Yeah, no, that's a great question. You know, what's the relationship between immune system and allergy? And you know, our immune system is a really very, very. This is why I think it's so awesome and such a wonderful act of creation. It's got to operate in a fairly narrow range. It's got to be strong enough that it mounts an attack against any invading organism, but it's got to be attenuated so that it doesn't mount attack against the individual. And you're absolutely right. Allergies are basically the immune system gone wild. The immune system reacting to ragweed pollen the same way it does to the Hib bacteria. So, yeah, the immune system has a lot of things to keep it in check. And on the one side of the coin, diminished immune system is a threat to infection. On the other side, a hyperactive immune system causes allergy and autoimmune disease. Yeah.
I don't know the historical aspect of seatbelts, but I know that as soon as the federal law was passed that seatbelts have to be used, fewer people, and mostly children, survived automobile accidents because it was federal law, they had to be strapped in. Is there a federal law that says your child has to be? How do we get to that point?
Yeah, boy, that's a tough one. We live in a confederation. We have 50 separate states, and many of those states feel very strongly about making their own rules and regulations. And right now, although there's a national body, the Advisory Council on Immunization Practice, that recommends what vaccines are necessary, that is not shared by all of the states. And unfortunately, although I agree with you, federal legislation would make sense, that taps into the political issues of states' rights, which is a huge issue. We're going to, I promise to quit right at noon. I'll be hanging around if anybody has any individual questions that they want.
So before you go, could you just say 2 words about herd immunity, just because I'm sure a lot of us have...
Sure. Yeah, we can start passing these out. Yeah, herd immunity is pretty straightforward. Let's say that we have a classroom that has 30 children in it. 29 of those children are immunized against measles, 1 isn't. Then somebody comes into that classroom who's been on vacation at Disney World and has measles. So if 29 kids are immunized and 1 isn't, that one who isn't is probably going to be okay, because all those other people that are immunized prevent that one person from getting it. What if there's only 25 kids in the class immunized. And then all of a sudden, the 5 that are unimmunized are at a little greater risk. 20, 15. This is the problem with herd immunity. People who refuse vaccines are not only risking themselves and their own children, they're risking the children of others.
And conversely, those who choose not to get immunized are protected as long as the herd immunity is.
We call those the freeloaders, exactly. So the parent who didn't immunize that one kid in the class, if they're just making so, yeah, why bother? Because the other 29 kids they're freeloaders.
So we do have to shut it down now just to be respectful of time and to let the teachers upstairs be free and whatever. So, but as Todd said, he's going to hang around if you want to ask him some stuff one-on-one. Thank you so much, Tom. We assume